Hello and welcome back to Tech and Titanium. I'm Dexter Maddox, an oral surgeon and the founder of IMvision Dental. We're here to help fellow implant surgeons leverage innovative technology to optimize practice operations, increase efficiency, and reduce stress. We're continuing our series on the journey of transitioning from WinOMS to Sensei, providing you an unfiltered look at the changes, challenges, and triumphs along the way. We're turning our focus towards the clinical aspect of Sensei, as experienced by our assistants. The clinical tools they use need to be efficient, reliable, and straightforward. That's why we're excited to explore how Sensei has impacted this critical part of our practice. Stay tuned as we sit down with Chris to discuss his hands-on experience with Sensei. We've got some in-depth questions lined up that will tackle everything from documenting medical histories and prescriptions to managing patient files and x-rays and tracking procedures. How has the transition from WinOMS to Sensei influenced the workflow of documenting patient care, such as medical history, prescriptions, and treatment plans?
So I think as far as documenting past medical history, prescriptions, and treatment plans, that part is relatively the same as far as the amount of clicks that you have to do. I think initially it's just learning the new system and where things are located. But once you open up the clinical portion, it's pretty simple to document the past medical history, medications, and then doing the treatment plans. The treatment plan part is just a little bit different just because there's a couple more steps that you have to do. But other than that, it takes about the same amount of time to document in the medical history in Sensei and WinOMS.
Can you share your experiences managing and uploading patient files and x-rays in Sensei? How does it compare with WinOMS?
That part is a little bit more difficult. So with scanning in WinOMS, we were able to scan double-sided documents and it would save as one file. In Sensei, everything has to be scanned in under a JPEG, and the functionality of Sensei will only allow you to do that one side at a time. So for double-sided documents, we do have to scan that in multiple times just to capture the front and the back side in the JPEG format. That part is a little bit cumbersome, but other than that, it's relatively the same. Now, as far as imaging goes, we haven't been able to use the functionality of the imaging in Sensei yet, so we are still uploading photos as an attachment right now.
Could you upload double-sided documents as a PDF?
Yes, you can. You can upload double-sided documents as a PDF. It just won't save as a JPEG.
So tell me about why have you not started using the imaging system with Sensei?
I believe it's a functionality capability of Sensei is my understanding, so I don't think that they've opened up that functionality for us to use yet. We do have our credentials. We're just waiting for the imaging portion to go live for Sensei.
How has Sensei impacted the process of documenting procedures?
In one word, delayed. So in Sensei, the functionality of documenting the anesthesia record during the actual sedation and surgery is a little bit more time consuming. You have to, it's not a point and click. There's lots of different options that you have to click through. The tab system of the anesthesia record is the same, but how you document is a little bit different. And so it just takes a little bit longer to actually put your drugs in there, put your oxygen in there, put your surgery times in there. Everything takes a little bit longer with documenting in Sensei. Other than it taking longer, the other issue that I've noticed is the way the Sensei saves. It's cloud-based, so it doesn't always save items that you document in there. So when you open up the chart again to look through it, you'll notice some items that were previously documented are now missing. So other than the cumbersomeness, the length of time, and then the missing items or the deleted items are probably my three biggest complaints with how it slows down our flow of moving patients through the office.
Do you have any proposed solutions for some of those issues, or any ideas that you think that would help that system, for example?
I think if there was a way that we could program the drugs in the system with dosages, so that way we can just put in the amount of dosages that we gave, would greatly speed up the process. That's how it was in WinOMS. The dosages were already put there, and we just put how much of each dose of the medications we gave. Currently, right now, we have to go in and put all of that in separate as far as the drug, the dosage, the frequency, the time, all of that has to be manually entered. So that would be my biggest suggestion, The other suggestion would be currently right now, because of billing, we have to double document the amount or the medications and the surgery times. And so that part leads to transcription errors. That would greatly help if we didn't have to double document for the transcription error portion as well. So those are the two biggest things I think would really help speed up the process.
How user friendly is Sensei, especially in the training setting? Do you find that it's easier to onboard new people on the team, or is it harder compared to WinOMS?
I think the onboarding time honestly is about the same. I do think Sensei's pretty user friendly. I think if you click around in it, it's pretty easy to find things. It's just how the system functions underneath that. But I think the training time would be about the same as WinOMS, and I do think Sensei's a user friendly system.
Do you think Sensei has overall, from a clinical perspective, improved our operations or made our operations more cumbersome?
Currently, right now, I think it has made the operations more cumbersome, sheerly because of the amount of time that it takes to document. That would be my biggest issue or complaint as far as how we move patients through. It greatly delays our time compared to WinOMS.
For entering prescriptions into WinOMS, is that easier or more difficult compared to, or entering into Sensei, is that easier compared to WinOMS? And are you using e-prescribing?
I think entering the prescriptions is about the same. I think it takes about the same amount of clicks and length of time as putting it in WinOMS. So I don't think printing the prescriptions or putting prescriptions in are too big of an issue. We are currently not doing e-prescriptions, although that is the plan to go to e-prescriptions in the future. But entering prescriptions are not an issue.
Is there a reason why that e-prescriptions has been delayed for implementation?
I don't know the answer to that question.
So if you could rate WinOMS out of 10 in terms of its efficiency in a clinical setting and compare that to Sensei's rating out of 10, what would you give those applications?
From a what standpoint?
From the standpoint of just how easy it is to go about your day, from specifically the clinical standpoint.
I would give WinOMS about a 7 or an 8, and I would give Sensei about a 6 or 7.
So overall, are you happy with the transition with Sensei, or do you think this is something that we should have delayed or not done at all?
I am happy. There are lots of things I like about Sensei, so I think the transition is going to be good in the long run once the kinks have been worked out. So I think it's fine that we moved to Sensei. We were having a lot of issues with WinOMS with the server base, so I think the cloud-based system definitely is going to be beneficial in the long run. So I don't think delaying it would have necessarily solved anything. I think anytime the implementation process started, we would have had some of the kinks to work through. That's with any system. But no, I don't think that it was a bad decision to move to Sensei.
Any other comments with Sensei?
I don't think so.
Thanks, Chris. That wraps up our dive into the clinical side of our transition to Sensei. I hope our assistant's insight gave you a more clear picture of what working with Sensei looks like on a day-to-day basis and how it influences our patient care. As you've seen, transitioning to a new practice management software system like Sensei can be a rocky road, but I do think it will ultimately lead to more streamlined operations and potentially better patient care. I hope this series is helping you understand the process of transitioning to new practice management software. As a reminder, we are not affiliated with CareStream in any way. I just wanted to share our experiences with my colleagues. Join us in our next episode as we continue to explore our journey with Sensei. If you found this video useful, please hit the like button and share it with your colleagues. And if you haven't already, please subscribe to our channel to stay updated. Until next time, this is Dexter Maddox signing off. Stay curious, stay innovative, and I'll see you in the next video.